Welcome to the HBOT News Network and the Research Rundown. And this is going to cover the COVID-19 pandemic. And I know some people call it the plandemic, and I'm not totally opposed to that. The title of the paper is The Effects of Hyperbaric Oxygen on Functional and Structural Connectivity in Post-COVID-19 Conditioned Patients. It's a randomized sham-controlled trial, so it's pretty well done. I would say a lot of detail is in here. One of the things that you'll find in it is really how COVID is affecting the brain, and in particular the amygdala, which is your emotional centers, and the hippocampus, which is where your memories are stored. And so people that are feeling this brain fog generally are dealing with some emotional reduction or issues, and also having issues with their memory. And so by structural and functional, it's looking at sort of that, can I multitask anymore? Number one, that would be sort of functioning. How am I functioning in my job or in my life? And structural would be like an MRI, where it's looking actually at the structure of the brain and the impact on the brain. So it's very clear that with brain fog and some of those conditions that we hear about coming out of COVID-19, that hyperbaric oxygen provides significant improvement. So if you have COVID-19 or you've had it and you're suffering, it can be chronic. It could be a year later. There's significant gain for individuals that get hyperbaric oxygen with brain fog. And so maybe this is nothing new. You may have heard this with some of our guest speakers, some of the doctors coming in here. This study confirms it, so it's a very detailed study. So hopefully if you're dealing with brain fog, you can seek out some hyperbaric oxygen therapy and get rid of the brain fog. I've talked to many people that have done that, and it's rather quick. And in some cases, as little as 5 treatments, and they feel like they're back and that brain fog is gone. So good luck with that. Thank you.